Well, welcome to Medical Dialogues. I'm Roshni. Let's look at today's top news. Patanjali MD Acharya Balkrishna tenders unqualified apology. Amidst the ongoing dispute over misleading advertisements by Patanjali Ayurved, Managing Director Acharya Balkrishna has issued an unreserved apology to the Supreme Court. This moves come after both he and Baba Ramdev were directed to personally appear before the Supreme Court in response to a contempt notice. Balkrishna submitted an affidavit explaining that the controversial advertisement was intended to convey general statements but inadvertently included offensive language. He stressed that the advertisement was made in good faith and that the person responsible for its creation was unaware of a specific court order dated 21st of November last year. This order had cautioned the company against disseminating false and misleading claims about the efficacy of its medicines in treating various diseases. Balkrishna's apology and clarification aim to address concerns raised by the court regarding the company's advertising practices. As the NEET PG 2024 gets preponed, upset aspirants take to social media. The recent decision by the NMC to move up the date of the NEET PG 2024 from 7 July to June 23rd has sparked a wave of frustration among aspiring candidates. Aspirants have flooded social media with their grievances, questioning the rationale behind the decision and highlighting the stress it adds to their preparation. This scheduling change adds to a history of alterations, with the exam initially set for 3rd of March, then speculated for early July before being officially scheduled for 7 July. The NMC's announcement not only shifted the exam date but also maintained the internship completion cutoff at 15th of August for eligibility. Critics ranging from students and professionals within the medical community to exam strategists have expressed dismay at the lack of consideration for the impact on students. Homeopath poses as gynaecologist, prescribes allopathic medicines, consumer code slabs compensation. State Consumer Disputes Redressal Commission in Lucknow recently ruled in favor of a man whose pregnant wife died during childbirth at a private nursing home. Holding both the nursing home and a homeopathy practitioner accountable, the commission directed them to pay ₹30 lakh in compensation. The court determined that the practitioner misrepresented herself as a gynaecologist and prescribed allopathic medicines, constituting medical negligence. It also noted a lack of proper medical protocol, especially in addressing postmortem hemorrhage, which ultimately led to the patient's death. The commission emphasized the importance of accurate representation of medical qualifications and adherence to protocols in patient care. The ruling further highlighted the need for stringent monitoring of medical practices to ensure patient safety. The awarded compensation aimed to provide redress for the emotional distress and economic hardship faced by the deceased family. High Court warns Delhi Health Minister Secretary on failure to bring new health law. The Delhi High Court issued a stern warning to the Delhi Health Minister and Secretary, admonishing them for their failure to bring forth a new health law. The court expressed concern over the impact on the common man due to the ongoing conflict between the officials, highlighting the generation of inaccurate lab reports affecting citizens. The bench emphasized the need for practical solutions and urged the officials to prioritize the welfare of the public over personal disputes. Threatening jail time if the situation persisted, the court underscored the officials' duty to serve the people and ensure their well-being. The court was addressing a petition filed in 2018, alleging the operation of unauthorized laboratories in Delhi, providing incorrect reports to patients. Despite claims by the minister that the Delhi Health Bill was finalized in 2022, the court questioned the delay in sending it for central approval. Considering the time taken, the court suggested implementing the central government's Clinical Establishment Act 2010. The court dismissed the idea of using the court process as a strategic tool, asserting its independence and commitment to justice. The petition highlighted the proliferation of unregulated labs in Delhi, posing a threat to citizen lives. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.